All right, everyone, welcome to our April webinar series. My name is Safa Basadika. I'm a supervising prevention consultant for NJ4S Union Hub. Today, we are going to be having a presentation presented by our very own Bintou NDoye, and she is going to be hosting our first webinar out of our April series. And April is Stress Awareness Month. So without further ado, I'm going to be introducing you all to Bintou. She is a prevention consultant at Prevention Link, serving the NJ4S Union Hub. With a strong commitment to community health, Bintou focuses on making a valuable difference in underserved populations. She holds a Bachelor of Science in Public Health with a concentration in community health education and a Master of Public Health with a focus on health systems, administration, and policy. These qualifications underpin her expertise in public health and policy. Outside of her professional life, she enjoys drawing, painting, and graphic design, and she enjoys a lot of other things like planning stuff and parties and hosting and surprising people. She does a really great job at that. And she enhances her ability to convey health and concept of creativity, and she's a very creative member of our team. So without further ado, I'm gonna hand it over to Bintou. So Bintou, you can go ahead and share your screen, and the floor is yours.
Thank you for that wonderful introduction. My name is Bintou, and I'm just been going over today. Our topic is maternal mortality. Understanding what maternal mortality is. So that refers to the death of a woman while pregnant or within 42 days of pregnancy. Globally, each year, approximately 287,000 women die from pregnancy-related complications. And within the United States, we have the highest maternal mortality rates among developed nations, which is a 32.9. This is as of 2021 deaths per 100,000 live births. So some key disparities or what is causing these issues. So maternal mortality outcomes vary by race, socioeconomic status, access to healthcare, and marginalized groups that face the highest risk. Black women in particular are nearly 3 times more likely to die from pregnancy-related causes than white women. What other factors do you think are big contributors to the United States having a highest maternal mortality rate? They can lack access to gynecological services and education, maybe transportation to appointments. That could be a big contributor to a disparity. Lack of insurance coverage, that's a big one. Some key causes of maternal mortality. So hemorrhages, hypertensive disorder, infection, sepsis, unsafe abortions, cardiovascular conditions, and lack of access to prenatal and postpartum care. What do you think can be like the most preventable cause of maternal mortality based off of what's listed? With lack of access to prenatal and postpartum care, that is the most preventable. It's a systematic issue, so that affects everything else. So if a pregnant person never sees a provider, complications like hypertension, infection, and cardiovascular, everything else that would go undetected. Many maternal deaths happen because warning signs are missed. So like routine prenatal visits that allow for early detection and treatment, those are being missed. So therefore, they're not having that preventative care. Also, policy, funding, and community-based interventions can make a huge difference here. So like expanding Medicaid postpartum coverage, mobile clinics, doulas, etc. Those can be beneficial. And this is a space where public health advocacy and infrastructure can really have an immediate impact and a meaningful impact at that. Some honorable mentions of what can be most preventable, I would also like to add is unsafe abortions. So is also highly preventable with comprehensive sex education, contraceptive access, and safe abortion services. But prevention really depends on depends on political and legal environments, which is kind of hard to control in some parts of the United States. And hemorrhages, that's a leading cause globally, but with proper training and supplies and timely interventions, is very treatable if the system is functioning. Now we're just going to dive a little bit more into disparities in maternal health. So when we talk about disparities, first highlighting racial and ethnic disparities. So Black, Indigenous, Latina women experience higher maternal mortality rates due to systematic healthcare inequities. Some social economic factors, so low-income women may lack access to prenatal care, proper nutrition, and skilled birth attendants. For the social determinants of health, housing, education, and access to healthcare services all impact maternal health outcomes. And for implicit bias in healthcare, studies show that healthcare providers often dismiss pain and symptoms reported by Black women, leading to inadequate care. So, with this, I wanted to kind of gauge everyone's perspective and how what our ideas are. If an example was two patients, two pregnant women with the same, pretty much identical symptoms, but one is white, fluent in English and insured, and the other is Black and primarily speaks Spanish and is uninsured, how might their experiences to care differ? Even with both patients presenting with the same care, the same symptoms, their care might differ due to implicit biases, structural racism, and systematic barriers. The white patient who was insured may be taken more seriously or seen faster and offered more comprehensive care, while the Black patient who is uninsured may experience delays and have their pain or symptoms be dismissed. And face communication barriers, especially if English isn't first language. Um, these differences aren't just about individual attitudes, but it's also about how our healthcare system has been historically and systematically underserved people of color. And this is particularly seen in Black women being the most prevalent to die in these circumstances. Insurance statuses, language access, and provider biases all intersect to impact the quality of care and outcomes. The role of the healthcare system. So, as we've been talking about, many women face delays in seeking care, reaching care facilities, and receiving adequate treatment. Some ways that could be mitigated is through expanding Medicaid and other healthcare programs that ensure continuous maternal care before, during, and after pregnancy. And also something that can be important is midwifery led care and doula support because it's been shown to improve maternal health and outcomes to reduce mortality rates. Advocacy and solution. So some potential advocacy policy solutions that can be made through the community-based programs that provide education, screening, and visits, at-home visits to those who are at risk. So those who don't have access to transportation or other social determinants that's preventing them from receiving preventative care and also any conditional care that's important. Local organizations that support pregnant women and new mothers, they would need greater funding and resources. And with that, a comprehensive policy proposal aimed at addressing racial disparities in maternal health care would be important. And several states have also extended postpartum Medicaid coverage to 12 months to ensure continued care for new mothers. So if we expand that all across the United States, I think that would be great. And what can we do at the community level? So where we're at now. We can raise awareness. So there's public health campaigns that educate communities about maternal health, risk, and preventative care. Access to education. So that is learning our accesses, so prenatal cares, mobile clinics, telehealth services that can bridge gaps in maternal care, and community involvement and support systems. So encouraging family and social networks can greatly be impactful to a woman's mental health and also their well-being, especially in a time of pregnancy.
Thank you so much, Bintou. That was a really good venue for us to kind of open up for discussion. I know some of us are some are mothers, some are not, but we did have an opportunity to kind of have these discussions about the disparities and just, healthcare in general. Very informative, very great conversation. If you would like to see what NJ4S has going on, follow us on social media. Jerusha says, great topic. Thank you so much, Bintou. You did a wonderful job. Thank you for the opportunity to educate us on this topic. Like I said, follow us on social media, NJ4S Union Hub. You can send us an email, NJ4S at prevention links. You can let us know your questions, comments, concerns, and you can just follow us to see what else we have going on in the community. Other than that, we will see you next week, and we hope you have a wonderful rest of your day.